Seniors, what if one simple morning habit with olive oil could quietly protect your arteries and your heart? As we grow older, our arteries naturally face more stress than ever before. Years of inflammation, poor dietary fats, hidden sugars, and a slower metabolism can cause arteries to stiffen and narrow, often without obvious symptoms. Many seniors don't realize there's a problem until it becomes serious. That's why heart health after 50 isn't just important, it's essential for independence, energy, and longevity. In recent years, doctors and nutrition experts have taken a closer look at extra virgin olive oil, a staple of the Mediterranean diet, known for its heart protective properties. Cultures that consume olive oil daily show lower rates of heart disease, even in older age. This has sparked interest in a gentle practice often called an olive oil fast. Now, let's be clear, this is not a crash fast or a miracle cleanse. For seniors, an olive oil fast simply means using olive oil strategically in small amounts to reduce inflammation, support healthy cholesterol, and improve blood vessel function. When done safely, it can become a powerful addition to a heart-smart lifestyle. Today, we'll explore how this simple, affordable habit may help support cleaner, healthier arteries while keeping safety, balance, and science at the center of everything we discuss. After the age of 50, artery health becomes one of the most important factors determining overall longevity and quality of life. Arteries are the highways of the body. They deliver oxygen and nutrient-rich blood from the heart to every organ, muscle, and cell. When these highways are clear and flexible, the body functions smoothly. But as we age, arteries naturally begin to lose elasticity and become more vulnerable to damage. One major reason artery health declines after 50 is chronic inflammation. Over decades, exposure to processed foods, excess sugar, unhealthy fats, stress, environmental toxins, and sedentary habits creates low-grade inflammation inside the blood vessels. This inflammation damages the inner lining of the arteries, known as the endothelium. Once this lining is weakened, cholesterol particles can more easily stick to artery walls, beginning the process of plaque buildup. Another critical factor is how cholesterol behaves in an aging body. After 50, metabolism slows, and the liver becomes less efficient at clearing excess LDL cholesterol from the bloodstream. When LDL cholesterol becomes oxidized, it turns especially dangerous, triggering further inflammation and accelerating plaque formation. At the same time, HDL cholesterol, the type that helps remove excess cholesterol from arteries, often becomes less effective with age. What makes artery disease particularly dangerous for seniors is that it often develops silently. Many people feel perfectly fine while plaque slowly accumulates for years. There may be no warning signs until blood flow becomes significantly restricted, leading to high blood pressure, chest pain, shortness of breath, heart attack, or stroke. That's why heart disease is often referred to as a silent killer, especially in older adults. Reduced artery health also affects more than just the heart. Poor circulation can lead to fatigue, cold hands and feet, memory problems, erectile dysfunction, slow wound healing, and reduced physical endurance. In other words, stiff or clogged arteries don't just shorten life, they reduce independence and daily vitality. After 50, the body's ability to repair arterial damage also declines. This makes prevention and support far more effective than waiting for symptoms to appear. While medications may be necessary for some individuals, lifestyle strategies, particularly nutrition, play a powerful role in slowing or even partially reversing arterial damage. This is why gentle, science-backed dietary approaches are so important for seniors. Extreme fasting or harsh cleanses can stress an aging body, but heart-healthy habits that reduce inflammation and improve blood vessel function can make a meaningful difference. Supporting artery health is not about chasing quick fixes. It's about consistently giving the body what it needs to protect and maintain these vital blood vessels. Simply put, after 50, artery health becomes the foundation of healthy aging. When arteries are supported, the heart works more efficiently, the brain stays sharper, energy improves, and seniors are far more likely to enjoy active, independent years ahead.
Extra virgin olive oil is far more than a simple cooking ingredient. It is one of the most thoroughly researched heart-healthy foods in the world, especially beneficial for adults over 50. What sets it apart from other fats is its unique combination of monounsaturated fatty acids and powerful natural antioxidants called polyphenols. Together, these compounds support artery health at multiple levels. First, let's talk about fats. As we age, the type of fat we consume becomes more important than the amount. Extra virgin olive oil is rich in oleic acid, a monounsaturated fat that helps lower harmful LDL or bad cholesterol while supporting healthy HDL or good cholesterol. Unlike refined seed oils or trans fats, olive oil does not promote inflammation. Instead, it helps calm inflammatory processes that damage artery walls over time.
One of the biggest threats to artery health is oxidized LDL cholesterol. When LDL cholesterol becomes oxidized, it sticks more easily to artery walls and triggers plaque formation. The polyphenols in extra virgin olive oil act as antioxidants, helping protect LDL cholesterol from oxidation. This means less plaque buildup and reduced strain on the arteries. Extra virgin olive oil also supports the endothelium, the delicate inner lining of blood vessels. A healthy endothelium allows arteries to expand and contract smoothly, helping regulate blood pressure and improve circulation. Studies show that regular olive oil consumption improves endothelial function, which is especially important for seniors whose arteries may have lost flexibility with age. Another key benefit is olive oil's ability to reduce chronic inflammation. Inflammation is the hidden driver behind most cardiovascular diseases. The polyphenols in extra virgin olive oil work in a similar way to mild anti-inflammatory compounds, helping reduce inflammatory markers throughout the body. Lower inflammation means healthier blood vessels and a reduced risk of arterial damage. Research from Mediterranean populations provides strong, real-world evidence. People who regularly consume extra virgin olive oil, often daily and frequently in raw form, have significantly lower rates of heart disease and stroke even in older age. These benefits are not seen with low-quality or refined oils which lack polyphenols. Quality is crucial. To support artery health, olive oil must be extra virgin, cold-pressed, and minimally processed. Light or refined olive oils do not provide the same protective effects. When used consistently, extra virgin olive oil acts like daily nourishment for the arteries, helping them stay flexible, less inflamed, and better protected as the body ages. When seniors hear the term olive oil fast, it can sound extreme or even risky. But in reality, a senior-friendly olive oil fast is not about starvation, skipping meals for days, or shocking the body. In fact, those aggressive fasting methods can be harmful after 50. For older adults, an olive oil fast is best understood as a gentle, short, and supportive nutritional reset designed to reduce inflammation and support artery health without stressing the body. At its core, an olive oil fast for seniors usually involves a small, intentional amount of extra virgin olive oil, most commonly taken in the morning on an empty stomach. This is typically 1 to 2 tablespoons, sometimes combined with warm water or a squeeze of lemon. The rest of the day is not food-free. Instead, it includes light, whole food meals such as vegetables, lean protein, and fiber-rich foods. The goal is nourishment, not deprivation. Why olive oil? Extra virgin olive oil provides healthy fats that signal the body it is safe and fed. This is extremely important for seniors because prolonged fasting can cause drops in blood sugar, dizziness, weakness, and muscle loss. Olive oil supplies steady energy, helps stabilize blood sugar, and reduces hunger hormones, making the body feel supported rather than stressed. Another key purpose of this gentle fast is to give the digestive system a break from inflammatory foods, especially refined carbohydrates, sugars, and processed oils. As we age, digestion slows and insulin sensitivity often declines. By temporarily simplifying food intake and emphasizing healthy fats, the body may become more efficient at burning fat for energy and managing cholesterol. Olive oil also stimulates bile production, which plays a critical role in digesting fats and eliminating excess cholesterol. This process supports the liver and may help the body handle cholesterol more effectively, an important factor in artery health.
Many seniors notice improved digestion, less bloating, and a feeling of lightness when olive oil is used this way. It's important to understand that an olive oil fast is not meant to be done every day. For most seniors, it may be practiced occasionally, such as once a week or for a short period, always depending on individual health conditions. Consistency with healthy eating matters far more than frequent fasting. Equally important is personalization. Seniors with diabetes, low blood pressure, gallbladder issues, or those taking medications must approach any fasting strategy cautiously and ideally with medical guidance. Listening to the body is essential. If weakness, nausea, or dizziness occurs, the fast should be stopped. In simple terms, an olive oil fast for seniors is not a cleanse or miracle cure. It's a careful, respectful approach that uses one of nature's most heart-protective fats to support metabolism, reduce inflammation, and encourage healthier habits, while keeping safety at the center. When an olive oil fast is practiced carefully and responsibly, many seniors may experience meaningful benefits over time. These benefits do not appear overnight, and they are not dramatic detox effects. Instead, they are gradual, supportive changes that reflect improved internal balance, reduced inflammation, and healthier circulation. Safety and moderation are the keys to seeing these benefits without placing stress on an aging body. One of the first benefits many seniors notice is improved digestion. Extra virgin olive oil stimulates bile flow from the liver and gallbladder, which helps break down fats more efficiently. As digestion improves, seniors may experience less bloating, fewer feelings of heaviness after meals, and more regular bowel movements. Better digestion means nutrients are absorbed more effectively, something that becomes increasingly important with age. Another potential benefit is better cholesterol balance. Research shows that regular consumption of extra virgin olive oil can help reduce LDL cholesterol oxidation while supporting the function of HDL cholesterol. When HDL works properly, it helps transport excess cholesterol away from the arteries and back to the liver for processing. Over time, this may reduce the burden on artery walls and support healthier blood flow. Many seniors also report more stable energy levels. Unlike refined carbohydrates that cause spikes and crashes in blood sugar, healthy fats like olive oil provide slow, steady energy. This can help reduce mid-morning fatigue, shakiness, or cravings for sugary snacks. For older adults, stable energy supports better mobility, focus, and overall daily functioning. A gentle olive oil fast may also help reduce chronic inflammation, which is a major contributor to artery damage, joint pain, and cognitive decline. The polyphenols in extra virgin olive oil have anti-inflammatory properties that work quietly throughout the body. Lower inflammation creates a healthier environment for blood vessels, muscles, and organs to function properly. Another subtle but important benefit is appetite and craving control. Olive oil promotes a feeling of fullness and satisfaction, which may help seniors reduce overeating or reliance on processed foods. This can indirectly support weight management, an important factor in heart and artery health after 50. Some seniors even notice improvements in mental clarity and mood. Healthy fats support brain function, and improved blood flow can enhance oxygen delivery to the brain. While these effects vary, they highlight how artery health impacts more than just the heart.
It's important to emphasize that these benefits depend entirely on doing the olive oil fast safely. Overuse, prolonged fasting, or ignoring medical conditions can reverse these gains. When practiced gently and combined with a balanced, heart-healthy diet, an olive oil fast can become a supportive tool, not a risk, on the path to healthier aging. While extra virgin olive oil is widely recognized as a heart-healthy fat, an olive oil fast is not suitable for everyone, especially among seniors. After 50, the body becomes more sensitive to changes in blood sugar, hydration, and medication interactions. That is why safety must always come first. Understanding who should be careful or avoid this practice altogether is essential to protecting health rather than risking it. First, seniors with diabetes or blood sugar disorders should approach olive oil fasting with extreme caution. Even though olive oil does not spike blood sugar, reducing or delaying meals can still lead to hypoglycemia, especially for those taking insulin or glucose-lowering medications. Symptoms such as dizziness, sweating, confusion, or weakness are warning signs that the body is not tolerating the fast. Second, individuals taking blood pressure medications or blood thinners should be careful. Olive oil can support blood vessel relaxation and circulation, which is beneficial, but when combined with certain medications, it may enhance their effects. This could potentially lead to low blood pressure, lightheadedness, or increased risk of falls. Any fasting routine should be discussed with a healthcare provider in these cases. Seniors with gallbladder problems should also avoid olive oil fasting. Olive oil stimulates bile release, which can trigger pain or complications in people with gallstones or gallbladder disease. For these individuals, even healthy fats can cause discomfort or digestive distress. Those who are underweight, frail, or experiencing muscle loss should not engage in fasting practices. After 50, maintaining muscle mass is critical for balance, strength, and independence. Skipping meals, even briefly, can accelerate muscle breakdown and increase the risk of weakness and falls. Another group that should be cautious includes seniors with a history of eating disorders or those who experience anxiety around food. Any form of fasting can trigger unhealthy patterns or stress, which ultimately harms both physical and mental health. Even healthy seniors should remember that an olive oil fast is optional, not necessary. Many of the benefits of olive oil can be achieved simply by using it daily in meals, drizzled over vegetables, salads, or cooked gently at low heat. Fasting is not a requirement for heart health. Most importantly, seniors should listen to their bodies. If symptoms such as nausea, weakness, headaches, or dizziness appear, the fast should be stopped immediately. Consulting a healthcare professional before trying any fasting routine is always the safest approach. In summary, olive oil can be a powerful ally for artery health, but only when used wisely. For seniors, the goal is not to push the body, but to support it gently, safely, and sustainably. As we come to the end, remember this important truth. Healthy arteries are not built through extreme cleanses or quick fixes. They are protected through small, consistent, and smart choices. Extra virgin olive oil, when used safely and wisely, can be a powerful ally in supporting artery health, reducing inflammation, and protecting your heart as you age. An olive oil fast is not a miracle cure, and it's not necessary for everyone. But for some seniors, a gentle, informed approach can become one more tool in a heart-healthy lifestyle, alongside balanced nutrition, regular movement, good sleep, and medical guidance. The goal is longevity with strength, clarity, and independence. If you found this information helpful, take one simple step today. Start paying closer attention to the fats you use daily. Choose high-quality extra virgin olive oil, use it intentionally, and always put safety first. Like this video if you believe seniors deserve clear, honest health guidance. Comment below and tell us, do you already use olive oil daily, or are you thinking about starting? Be sure to subscribe to the channel for more science-backed, senior-friendly health tips designed to help you age strong, confident, and informed. Thank you for watching, and remember, it's never too late to support your heart and protect your future.